I'm Congressman Ted Lieu, and thank you so much for joining this Facebook Live town hall. We're going to talk about the care economy, especially with the law that has already passed, the American Rescue Plan, and the law we're working on that hopefully will pass, the American Jobs Plan. And I've got some tremendous witnesses with me here today. So as all of you know, Congress passed the American Rescue Plan that had basically four main issues. It was going to get shots into arms, kids back into school, people back into jobs, and cash into pockets. It's a transformative law that's already helping America get back on track. Our unemployment claims have now dipped to the lowest in a long time, and we're seeing the economy starting to heat up again. And we have a lot more people that have now been vaccinated. Now we're working on the American Jobs Plan, which is going to do a lot for the care economy, and to also make sure that we can view infrastructure not only as roads, highways, and bridges, but also as people infrastructure. And that also goes in line with a third bill we're working on, which is the American Families Plan, that's going to try to make their child tax credit permanent, as well as provide funding for education and healthcare. And what we're going to do is we're going to hear from our three amazing witnesses today, and then I'm going to have a panel discussion with questions, and hopefully all of you will be able to learn a lot today about the care economy and also what the benefits are in both the law that has passed and the bills that we hope to pass soon. So we have with us first Leilani Reed, who was born and raised in LA. She has been a home care worker in LA County for 16 years. Leilani began working as a caregiver for her daughter since she was diagnosed with ADHD and bipolar disorder at the age of 5. She now also provides care for her father, who is 70 years old and is starting to experience mobility and other health issues. Leilani is a proud SEIU 2015 member leader and is an executive board member where she has advocated and lifted up the need to lift up standards for caregivers who are predominantly composed of women and men of color. Leilani is also active in advocating in support of social justice issues that impact her community. She is also active as an ambassador for Imagine LA and a member of Open Door Worship Center. Leilani is a proud mother of 4 children and grandmother of 5 grandchildren. Thank you so much, Leilani, for joining us today. We also have with us AARP's Nina Weiler Harwell. Nina is Associate State Director for AARP California. She also holds a PhD. During her more than 20 years at AARP, Nina has managed federal and state advocacy campaigns on multiple aging-related topics, including caregiving, long-term support services, Social Security, Medicare, and the Affordable Care Act. Nina currently serves as AARP's California lead on caregiving, home and community-based services, LTSS, and state budget advocacy. She led AARP's efforts on the legislation that created the California Task Force on Family Caregiving and represents AARP on the California Aging and Disability Alliance, which is leading statewide efforts to create a model long-term care insurance benefit. Nina also served on a stakeholder advisory committee and the LTSS subcommittee for the California Master Plan for Aging, where she worked to ensure that AARP caregiving and age-friendly priorities were included in the plan's final recommendations. Thank you so much, Nina, for joining us. And finally, we have Jess Morales-Roqueto, who is the Civic Engagement Director of the National Domestic Workers Alliance and the Executive Director of Care in Action, where she spearheads advocacy and electoral campaigns for the 2.5 million domestic workers in this country. She is the co-chair of the Families Belong Together Coalition, the Campaign to End Family Separation and Detention, and a co-founder of Supermajority, a new women's political action group. I like that name. Jess is an alumna of Hillary for America, the AFL-CIO, Obama for America, and the Democratic National Committee. In 2019, Jess was honored in the First Time magazine's 100 Next cohort, a list of rising stars who are shaping their future. And thank you, Jess, for joining us today. So why don't we start off with Leilani. So if you want to go ahead and unmute.
Okay. Can you guys hear me?
Yes.
Okay. Good afternoon. My name is Leilani Reed, and I'm a home care worker here in Los Angeles. And I'm a proud member of my union, SEIU Local 2015. And I'm very honored to be here today And thank you, Representative Ted Lieu, for inviting me to speak to you all about an issue that is so important. I began my career in home care unofficially when my daughter was 5 years old and was diagnosed with ADHD and mental health illness, including being bipolar. Officially, I started working as an IHSS worker with Los Angeles County when my daughter turned 8 years old. Back then, my hourly wages was $5.50 an hour. 2 years ago, I also started to provide care for my 70-year-old father, who is starting to need someone to provide care for him as he began to lose his mobility. For both my daughter and father, it would be difficult for anyone else to provide care for them. They both need someone who understands them and their needs. My daughter needs someone to care for her who knows and understands how to de-escalate and provide support for those difficult days. For my father, who is going through a big transition in his life, he needs someone who can help him through this moment in his life. Currently in our country, there are many seniors and people living with disabilities who depend or need someone to care for them. I think of a fellow SEIU union member whom I met, who is currently undergoing a moment in her life where she is going from being a caregiver to her husband, and she herself needs someone to care for her. Her ability to provide care for her husband, I believe, has been already altered by an injury she sustained it while working at her job. This could happen to anyone. Nobody is immune from either providing care or being a caregiver or a lifetime. Home care workers are essential skilled, dedicated healthcare workers, and our job isn't as simple as just making someone breakfast, giving them their medication, and saying goodbye for the day. We help others live. The reality is that many of us are barely able to live ourselves. Imagine nursing homes of other facilities that provide care. They have CNAs, LVNs, RNs, dietary staff, janitors, social workers, laundry staff, countless staff, and resources and equipment. When caregivers show up to the homes to provide quality care, we do so without these resources. And we wear all of these hats all at once. Although now I make $15 an hour, the wage does not work. The wage is not enough to make ends meet in Los Angeles County. The national long-term care system isn't working either. And all healthcare have created a reality where a person's zip code determines access to essential health services and the quality of care they receive. It also means that quality of home care jobs and inconsistency. And it's why many of sisters and brothers across the country still makes less than $10 an hour. They don't even have the basic benefits like affordable health care or paid sick leave, and don't have the right to join a union. Nearly 90% of home care workers are women, and more than half of people of color. We do the work so many people cannot, but racist and sexist narratives call our jobs unskilled. Women's work and this devaluation means that we're not seen as people who need to be respected, protected, and paid a living wage. It's not right, and it cannot continue. I want you to understand that care works makes all other works possible. Home care workers make it so people in need of long-term care, whether they're aging parents, grandparents, or people with disability, can stay in their homes and communities, surrounded by the people and the things that they know and love. Having an injury and medical condition and disability, or getting older and needing someone to help you throughout the days, doesn't mean you cannot live to the fullest. Many home care clients are hardworking, dedicated workers themselves and make important contributions to the community. Even though our clients are no longer working, they will still have many more years to live. It's our job as caregivers to help them be themselves and stay active, engaged, and continue to do the things they love every day. But the low quality of home care jobs forces people to leave this workforce. And so there aren't enough home care workers to meet the demand for care for working families. Long-term care is often inaccessible and unaffordable. Care cannot wait, and working people are often forced to leave their jobs and provide unpaid care, and many aging adults and people with disabilities living away from their families have no choice but to forego the service and support they need. We need to build a strong care economy. We need a home care workforce that can answer the call for care when families are in need, and give families the peace of mind that they can continue to go to work and knowing that their loved ones are in a safe and care environment. Home care workers have been fighting for health care and long-term care justice for centuries. We've been angry, we've been frustrated, and we've been grieving for the struggles caregivers and clients face when we're not taken seriously. With our union, SEIU Local 2015, California home care workers have the power to make our voices heard. We can win, raise together, and we can win better benefits together. We can win funding for home care programs together, knowing that our union has our back. Help home care workers to keep fighting for the respect, protection, and pay we deserve. The more than 740,000 home care workers united in SEIU and the 2 million still fighting for a union share a vision of American where long-term care is accessible, affordable, and sustainable to all. Now, with the leadership and the support of the Biden administration, lawmakers like my Congressman Ted Lieu, home care workers, and our clients are finally beginning to see and hear a plan to make a long overdue investment in caregiving. It's absolutely essential in building back better and creating an economy that works for everyone. We need to invest in ensuring that there is access to care for our growing seniors population, for the people living with disabilities. One way to do that is to create pathway and higher wages and benefits for caregivers. For me, a pathway to $20, for example, would mean I wouldn't have to juggle payments and bills like I currently do. I wouldn't have to stress or worry about paying rent and deciding between which bill I am paying with each check. I would be more self-sufficient. Currently, I balance my limited funds and have to put $10 of gas, even though I need more, just to have enough money to cover other costs. I would also be able to be self-sufficient without having to work 3 and 4 jobs. This is exhausting. My son is in college, and a better wage would mean that I wouldn't be afraid to tell him that I cannot afford things that he needs to be successful in school. This would mean that I am secure with the basics. We are all going to need care. Folks need help and care for all types of illnesses. We matter, and caregivers are a big piece of the puzzle of bringing our county back and helping our country run. When that times come, don't you want the comfort in knowing a skilled, dedicated caregiver would be by your side if you or your family member suddenly need home care tomorrow? Are you confident that you will be able to get that resource and service you need? Don't wait to find out. Let's invest in care today to build a more promising tomorrow for us all. Care can't wait. Care is essential, and care is working. Care works and need to be respected, protected, and paid. So let's put care first and invest in care and caregivers now. Thank you.
Thank you, Leilani. And as you know, and the panelists know, and people who are watching, the American Jobs Plan has a significant investment for home care and elder care. And that's something we're going to keep pushing for in Congress. Next, we're going to have Nita make her remarks. If you want to unmute.
So good afternoon, Leilani. I don't know how I can surpass you. Thank you for all you're doing for workers, for your family, for your community. As myself, I am a caregiver for a young man with autism. We are fortunate that he is high functioning, but it still brings its challenges. He just started college, and so you still have some issues going on there. But fortunately, the state of California provides lots of supports. I do want to talk a bit about ARP and bring in the family caregiver perspective. So ARP, for those listening, is a nonpartisan nonprofit organization. We represent Americans and Californians 50 and over, empowering older Californians to choose to live as how they live as they age. We have 3.3 million members in California. Among our many priorities is caregiving. It is near and dear to ARP. It was among some of our founding priorities, going back to Ethel Percy Andrus, our founder, who was heartbroken yet inspired when she encountered a retired teacher who could not afford her own medical care, didn't have family caring for her, and was living in a chicken coop. That is a old story, but that has really launched us and propelled us forward for over 60 years now. ARP has done a lot of research on family caregivers. We actually have counted 4.7 million family caregivers in the state of California. Economic value of their unpaid contributions is about $63 billion, not million, $billion. We fight to support these family caregivers because they help make it possible for older Americans and other loved ones to live independently at home, which we know from our many research pieces. Over 80% will tell us consistently, I want to stay at home. I don't want to go to a nursing home. We know that every day, millions of Californians like Leilani help their parents, their spouses, their children with disabilities to remain at home. They help with medications and medical care, meals, bathing, navigating our systems of long-term services and supports. That's my role with our son, bathing and dressing, chores, and so much more. And our research also shows, this is national research, but over 60% of caregivers are still working. Conversely, 73% of workers are also caregiving. So they're actually holding down 2 jobs. Many are on call 24/7. They can't take a break. And as I will often hear from members, whether I'm in the community or one of our caregiving telephone town halls, I need a break. Where do I find services? People don't know where to go. So ARP really supports family caregivers, and this has become even more profound during the pandemic, so that they could stay at home and stay out of nursing homes, where there's been over 9,000 deaths of patients and staff in California alone from COVID-19. Caregivers also prevent unnecessary and costly hospitalizations. We actually advocate for many common sense solutions: help at home, flexibility at work, like paid family leave, paid sick leave, and many financial tools to help make these huge responsibilities just a little bit easier. And through advocacy, we do support family caregivers by advocating for a caregiver tax credits. We've tried to do that in California, so far unsuccessfully, but ARP is a strong supporter of the Federal Credit for Caring Act, which has been introduced in Congress. As noted, I actually work quite a bit on expanding paid sick leave, including the supplemental paid sick leave law, SB 95, that was passed this year, that gives workers up to 10 days of paid sick leave if they or a loved one is diagnosed by, cannot go to school, or has a quarantine order due to COVID-19. We continue to advocate for better paid sick leave, just basic non-COVID paid sick leave in the state. It's an ongoing fight. I'll also raise up that as you noted in the introduction, I do a lot of budget advocacy, and ARP California is a strong advocate for the caregiver resource centers, as well as the in-home supportive services program. We speak up pretty boldly on that. Certainly in the master plan for aging implementation, which has a number of caregiver recommendations, as well as an advocacy for a state benefit that will help individuals cover some of the costs of long-term supports and services. That's what the LTSS acronym stands for. We provide so many tools and resources for anyone. They're free. You don't have to be a member. We have our Prepare to Care guide, our online caregiving resource center. We have a fact sheet on California's paid leave laws. We have an 800 number for people who need caregiving support, a local resource finder, you name it, so many things. And the reason why, as well as, a statewide and local caregiver resource guide that will point you to nonprofit free resources, either statewide or in certain parts of the state. There's also caregiving online discussion and educational opportunities that caregivers can take advantage of. So before I close, I'd like to share, we hear heartbreaking stories all the time from our members. So I'm going to share a couple of stories. And one of the volunteers. I actually live up in Sacramento, and he lives in the Sacramento area. This is someone who had a pension, who had savings. His mother was diagnosed with Alzheimer's and dementia. She had to go to a memory care facility. He and his wife could not take care of her. She didn't have long-term care insurance. 4% of Californians actually buy long-term care insurance. It's not accessible for most people. He spent a huge chunk of his retirement savings to care for her. We've also have stories, and you can read some of them on our website, but just one individual that wrote us talked about her name. I'm not going to give her name, but said, I live with my mother. We have no other family members to help out. I've had to work part-time in order to be able to care for her, and my pay has taken quite a hit. It would be very helpful if we had the ability to get assistance with food, medical bills, and insurance, and maybe a tax break. My mother makes $1,000 a year, too much to qualify for Medicaid. It's hard being middle class and making ends meet when you have to cut your hours at work to be a caregiver. And another member who shared that she had to give up a prosperous career, took jobs to work around the schedule, a 90% pay cut, lived off of savings, which she depleted. And she's now, in addition to caring for her 94-year-old father, has to work in the middle of the night to teach overseas. And during the day, she also has to work to tutor students. So she's working 2 jobs in addition to caring for an elderly father who lives with her, meaning she has very little time for rest and sleep. And she notes, caregiving has taken a toll on me financially, physically and mentally, as well as even being able to pursue a stable life. It has been a tough road, and I continue to work several jobs to help my dad and I get by. So these are just some of the stories we hear all the time when we do caregiving telephone town halls. I mean, and there's several staff members on this call. Sometimes people are in tears because our family caregivers are not taken care of. There's an assumption that family caregivers will just do it because that's what families do. The average family caregiver spends nearly $7,000 out of pocket a year to care for a loved one. So imagine if you are someone who's retired and your median income is $50,000. That's a huge chunk of your income, especially in California, where the cost of living is so high. And if for Latino families, that number is over 9,000. So I'm just absolutely honored to be part of the discussion today. And again, really appreciate that you invited us to join. Thank you.
Thank you so much, Nina. Really appreciate your insightful comments. And next, we've got Jess. You want to unmute?
Yes, hello. Thank you so much for having us. Representative, you are one of our biggest champions. If everybody was like you in Congress, I think we would get a lot more done. So really glad to have you issue this invitation to us. And Nina and Leilani, thank you so much. Leilani, when I heard you talking, I heard the stories of all of the domestic workers that I work with. You know, whether you work in an institution or in a home, we're really seeing so much solidarity with all the people who provide work in the care economy. So I feel really lucky to hear your testimony. My name is Jess Morales-Drichetto, and at the National Domestic Workers Alliance, which I'm so proud to represent, we work with a whole ecosystem of partner organizations for over a decade, including our very good friends at SEIU, to lift up the quality of work for home care workers, nannies, and cleaners who work inside of our homes, providing caregiving services for working families across the nation. We've also worked to unite older adults and people with disabilities, very similar to the AARP, family caregivers in the home care workforce, so that we can create a care infrastructure that would meet our collective needs across our lifespan. So from the moment that we're born and to the moment that we pass away, that we would actually have care that is good care, provided by quality caregivers that people can actually afford. And I believe that we have a once in a lifetime opportunity to do precisely that right now. You know, the American Rescue Plan, and especially the funding in the American Rescue Plan for home and community-based services, really helps us weather the pandemic. And now with the American Jobs Plan and the proposed $400 billion investment in Medicaid, home and community-based services, we now have a historic opportunity to expand access for people with disabilities and older people, and to raise wages and improve the quality of jobs for the care workforce. I believe that this is among the highest impact job investments that we can make in our country, particularly if we want an equitable economic recovery for women, older women, and women of color in particular. One of the reasons for this is that the direct benefit of improving and creating home care jobs for this overwhelmingly majority women of color workforce includes many older workers. These are jobs, care jobs, are jobs that will not be automated. They can't be outsourced, so they're here to stay. But the problem is they've always been poverty wage jobs. It's impossible to make ends meet in these jobs, as Leilani talked about. And we currently have massive home care deserts, particularly in rural communities, because workers can't sustain on poor wages. So we need to make these jobs good union jobs. And unlike the good folks at SEIU, domestic workers, people who work in our homes that I work with, are actually prohibited from joining a union. So the care workforce still needs a lot of unionization. We also need to make sure that these jobs benefit more than the 42 million working family caregivers, the people that Nina was talking about, adult children or family members, also mostly women, that spend over 20 hours caring for a loved one on top of their full-time work. This will enable them to get back to work which is particularly important in light of the nearly 3 million women who've been pushed out of the workforce in the pandemic because of caregiving challenges, who are also disproportionately women of color. And there's a quality of life for older adults and people with disabilities who will have the services and support they need to live independently in the community with an investment in this care. We can have downstream savings in our healthcare system, prevent institutionalization and unnecessary rehospitalizations and emergency room visits that happen because of a lack of access to good caregiving, which will make sure that not only can the care that people get be better, but also that people can afford that care, which is one of the things we hear so often. And there's a really important immigration dimension to this. Undocumented workers are overrepresented in the care sector. In fact, at least 1 in 10 care workers are undocumented. We believe it's good policy to create a pathway to citizenship for undocumented essential workers in home care to help meet the demand and build the worker pipeline. Our nation is a nation in need of care. Before the pandemic, we were already struggling to access and afford the care we need because we failed to invest in care infrastructure, including the care workforce that makes everything else in our economy and society possible. The president's proposed investment in HCBS prioritizes an investment in a workforce that, because of racism, has faced exclusion from labor rights and protections since the New Deal. The fact that this majority women of color workforce is at the forefront of the jobs and infrastructure plan is not only good policy, it reflects a true commitment to equity and an economy that is equitable for all of us. Just like we transformed manufacturing jobs in the 20s and 30s from dangerous poverty wage jobs to jobs with a real economic mobility, we can and we must do the same for care jobs, and we will all benefit. This is our moment, which is why we have to pass this legislation now, and why I'm so thankful that we were able to join this today to talk about what I really believe is one of the most important policy issues of our time. Thank you so much.
Thank you, Jess, for your comments and all your great work. So this is being streamed on Facebook Live, and it's also going to be put on websites, and folks will be watching this in the future as well. And I know that some people who are watching this will not know very much about the care economy or even know very much about care workers and caregiving. So my first question goes to Leilani. And for people who don't know much about this subject, what is one thing you like them to know about the caregiving profession?
That we are essential and that our work is valuable and it's very important what we do.
Thank you. I thought I'd share with you my own story. So I have a uncle who lived in Taiwan, and they do actually have pretty good medical services, but they don't have the kind of in-home care services that we have here in the United States. And he was, this is about a decade and a half ago, he was diagnosed with brain cancer. And so he started over time to deteriorate in his ability to function. And his wife, my aunt, at some point started to have to care for him. At first it was a few hours a day, then it became part-time, then it became full-time. And she had to basically not work. And it was very financially, unbelievably difficult for their family. And to just realize for me, what a difference it makes that here in California and in the US, we have a different model. And it's one that not only provides dignity to people who are elderly or those who may be sick, but also it's just much more humane and provides a way to care for everyone who needs it without having people suffer financially devastating losses. So, so thank you, Leilani, for sharing. And then Nina, for people who are watching who are thinking, maybe I am actually doing that and I need to do it more, and the person I'm caring for is getting even sicker, I need to spend more time. How do they sort of get involved and become a care worker or apply? How would they go? What's the process?
So in California, the main program we have right now where somebody can actually be paid to care for a loved one would be in-home supportive services. I will say that one of the reasons why ARP is a big supporter of the program is, and Leilani can check me, but I believe 70% of the providers are family members. They're either direct, immediate or family members, at least according to the data I looked at. She's shaking her head on Department of Social Services last year. However, in-home supportive services does have some income and asset restrictions because it's basically tied to Medicaid. But for those who can qualify, you would go through your county. You might start with your area agency on aging. And if you type in area agency on aging online and put in your county, you'll find the number. You can access it through the Caregiver Resource Center. And actually, for a lot of caregivers, this is a state program that is free. If they cannot provide you respite or other services for whatever reason, they can at least help you with accessing the other programs. You could talk to Alzheimer's, but you would go through in-home supportive services. If you have to continue working, because many will, and many unfortunately will not qualify for in-home supportive services, please do take advantage of paid family leave, which now is open to employees of any firm of 5 or more. And so if you need time because you need to care for your mother up to 8 weeks out of a year, and 2 of you, meaning you and your partner or spouse, could also take this, you can access that, and it is now job protected. That means you can't get fired for taking it. You would get wages equivalent to about 60 to 70% of your pay, depending on your income. There's also paid sick leave. Now, as I noted, that's kind of limited, but paid sick leave applies to all employees who don't have it. If you don't have it through another resource like your employer, you can take up to 3 days if you need to take care of a parent who's sick, say they have the flu. If you need to take them to appointments, and it also applies to domestic violence situations where you may need to assist somebody with navigating that. So those are some of the programs. We would love to see them expanded. I should also mention Family Medical Leave Act, which is federal and applies to businesses of 50 or more. It's job protected, but doesn't provide pay. That's where the paid family leave program comes in. So if you're in a big business, you can get that and not worry about losing your job and get partial wage replacement. This is one of the reasons why we are advocating with the 2 partners right here. Your organizations are part of the Aging and Disability Alliance, why we are working towards a long-term care benefit in the state that would help to pay some of the costs of care. And ideally, when that program is stood up, would allow caregivers to get paid to provide that service. So those are some of the resources available.
Thank you, Nina. That was very informative. Really appreciate it. And my next question is to Jess. I'm curious about how the pandemic exposed some of the weaknesses in the care economy. And I assume it probably had a disproportionate impact on domestic workers. Is that right?
Yes, it absolutely did. I mean, one of the most important things I think it showed people is that we don't have enough support for care, that anyone who needs care, provides care, doesn't necessarily have the ability to access it. And I think quite importantly, it also kind of really threw in stark relief how important caregivers are. In particular, I'm thinking of a story actually from one of our members in California. They are the only person who comes and sees their elderly charge daily. And so what that meant during COVID is they actually had to make the decision of whether or not they were gonna pod with their children and family or with their elderly caregiver. And so many workers are so incredible that they really make really difficult choices. And this caregiver actually made the very difficult choice to decide to pod with her elderly charge, because otherwise she was worried that he might contract COVID and no one would know, or that he, may pass away and no one would know. And that's the kind of sacrifices that caregivers are having to make. And, that goes above and beyond doing a good job. There's also the piece of this, which is about caregivers also need care in their own lives. And so we know of so many caregivers who told us stories about having to make a really hard choice between going to their job, caring for someone else's kids, cleaning someone else's house, caring for someone else's family, or staying home with their own kids or their own family who couldn't go to daycare, were doing virtual learning. And that is another really impossible choice. And all of that is because we haven't put the investment into care infrastructure that we need, so that everyone who needs care can afford it and everyone who needs care can access it when they have a need for it.
Thank you. That makes a lot of sense, what you said. So Leilani, my first question to you was from the perspective of someone who may not know a lot about caregiving, the care economy. My next question is sort of the opposite of that. What if someone has been involved in caregiving and is now, just as sort of Jess said, they're really tired and they're facing a lot of obstacles and they're sort of at wit's end? Like, what advice would you have them if they're struggling to do the caregiving right now? What hopeful advice you have for those people?
To reach out, because we do have a backup service with other caregivers that they can reach out to, and they can reach out, and we do have a registry where they can call our MAX center, and there's support there, that there's other workers where we help one another. We feel like substitutes, for each other. So if they need, some time off, or, they having some issues, they can reach out to other workers, for that support.
Thank you. I did not know that. I learned something new today, and that makes a lot of sense. So thank you for sharing that. And Jess, I want to go back to you. A lot of their caregiving and the care economy are done by women, and particularly women of color. What kind of resources are there in particular to help women and women of color? And what do you think could be helpful as we look at the American Jobs Plan or in future legislation to make the care economy better?
Yes, definitely need to pass the American Families Plan in Congress. That is so important. Both the American Jobs Plan and the American Families Plan have to work together, because that's how we put people back to work and also make the investment that we need to, so that we can have real economic recovery. The other really important thing is, right now in Congress, there's the Domestic Worker Bill of Rights. The Domestic Worker Bill of Rights would make it possible for domestic workers to have really basic protections in many, many states, although happily not in California, which has a Domestic Worker Bill of Rights and often leads the way on progressive legislation like this. In many, many states, most workers don't have basic labor protections, because domestic workers are actually left out of the Fair Labor Standards Act that provides so many of basic labor protections to us. So that's something we really need to pass. As I've said before, domestic workers are overwhelmingly women of color, and especially when we're talking about elderly caregivers, you're talking about mostly Black women, mostly Latino women, many immigrant women, many undocumented women. So we have to really think about the intersections of the lives of the people who provide that care. They're coming as Black women, they're coming as API women, they're coming as immigrant Black women, immigrant Latino women. And that means there's lots of different legislation that can help support, and lots of different ways that they need care, frankly, from our government. So I think that for us, we really do try to address the whole person when we're working with workers. And that means that workers can come and share who they are in their own languages, as well as really make sure that they can advocate for policies that will help make their lives better. The other thing I'll just say is that it's also important for employers to be a part of this. If you employ a domestic worker in your home, so if you have somebody who comes and cleans your houses, your house once a month, or if you have a nanny that comes to help you make sure that you can do your job, you are an employer and you have a responsibility to make sure that you have a good relationship with a domestic worker who comes to your home. So really encourage anyone to go to domesticworkers.org. If you're an employer, go to employer.domesticworkers.org. We want to make sure that we are helping support anyone who is making all other work possible through their caregiving.
Thank you, Jess. When I was in the California State Senate, I was chair of the Labor Committee, and we passed out the Domestic Workers Bill of Rights. So we keep pushing. And then the last question today will go to Nina. And with your work with AARP, if you were in charge of the world and you could make a few changes to elder care, what would some of those changes you'd like to see be? You have to unmute. Yeah.
Yes. Oh, wow. Ideally, we would love to see funding and services for seniors or older Californians amply funded so that people would be fully supported in their homes and communities.
Just real quick, what is the age of that when you say older Americans?
So we're talking about 50 and over is our membership.
Okay, thank you.
So, and it's not just people 50 and over, of course, because as part of the work on the master plan for aging, that was a California for all ages plan. But I will give an example. The American Rescue Plan sent $5.2 billion to California to be spent on home and community-based services. And when that plan came out last week from the administration here in Sacramento, there was so much good in there. It was amazing. If we could only get to that. But ideally, what we'd like to see is a full one-stop, no wrong door system that would handle the needs of individuals as well as their caregivers more than adequately, but really ensuring that it was not based on income, that the workers who provide the services are being paid a more than sufficient wage, along with various benefits, so that they would want to continue in that capacity. We certainly heard so much last year, literally about nursing homes, people not showing up to work, not just because they was it really worth it to go in for a minimum wage when I could risk getting a deadly illness? So the number one thing would be, of course, the full enactment of the master plan for aging here in California, but really building out this robust, no wrong door, user-friendly system of long-term supports and services that would support the care recipient regardless of income, that would support their caregivers, and also be amply funded so that workers would want to enter the field and continue working in the field. That's just some of it. I've been working on this for over 20 years in Sacramento, and just seeing the plan that came out from the administration last week was like, there were things in there nobody expected to be in there. It was wonderful. So we're getting there, but we have a lot more work to do.
Thank you, Nina. And I'm going to conclude now by first thanking Leilani, Nina, and Jess for your time today and your expertise in sharing your insights. And for anyone who's watching, if you have any issues with a federal agency, please contact our office and we will assist you. Although we're not in the office physically, all of our staff are working remotely, and we will get your concerns and we will work on them. And let me just say a few hopeful words as we conclude. With the vaccinations happening at a rapid pace now, particularly in California, where over 70% of adults are vaccinated, we're going to get back to normal sooner rather than later. And these vaccines are tremendously effective. If you have any questions or you're vaccine hesitant, please consult your doctor. But what we're seeing is that we're going to get back to a normal economy soon, and we're going to build back better, and America is going to become an even better place to live, work, and play. So thank you so much for watching today, and thank you to our amazing panel. Have a great day.